So it's no longer a question of whether the Ebola virus could come to our area. The question tonight is, are we ready if it does? Local 12's Angela Ingram has been looking into that, and she joins us from Anderson Mercy Hospital with what she has learned. Angela.
Well, Cammie, a doctor here in the emergency room tells me that if an outbreak or if a patient with Ebola were to come into our area, the area is well equipped to deal with such a case. But she also says it's highly unlikely that anyone in our area should be concerned unless they travel to an area where there's an outbreak. Doctors at Mercy Health say the hospital works very closely with the Centers for Disease Control and local health departments to be aware and ready. They also work on high suspicion, so they're not missing any symptoms that are disturbing.
Most commonly, you can see bleeding from the GI tract, which can manifest as rectal bleeding, blood in the stool. But you can cough up blood or throw up blood. Those are the more severe versions.
But if a patient with Ebola were to come to this hospital, there are isolated rooms in the emergency department for people who are highly contagious and several rooms that are called negative pressure rooms.
And what that means is we actually can circulate the air independent in that particular room from the rest of the hospital's air supply systems. We also have decontainment areas where we're able to shower and rinse off. And then what we have to do is make sure that everybody is wearing personal protective equipment.
There are special isolation carts with goggles, face masks, and gloves that prevent diseases from spreading. Physicians would likely treat the symptoms of Ebola since there is no cure. But Dr. Krista Varnell says people here should not be in fear just because there is a case in the States.
The high-risk issues dealing with Ebola are people who are in an area of outbreak. This is not yet, thankfully, an area of outbreak. And our case that has been detected here in this country was a person, again, who had traveled into that area.
And Dr. Varnell says obviously it's best to avoid any area where there is a high case of Ebola or any known case of an outbreak. And she says often when patients come into the hospital, immediately physicians begin to ask them questions while interviewing them about whether they've recently traveled, especially international travel. Live tonight in Anderson Township, Angela Ingram, Local 12 News. Cammie, back to you.
Nice to know the hospitals are ready. Angela, thank you. Dr. Varnell says the mortality statistics range anywhere from 50 to 88%.